Are you already registered?
Welcome, dear viewers, to our natural medicine format today. Alzheimer's and dementia are often hopeless diagnoses. But what actually causes them? And are there ways to shed light on the dark, perhaps to relieve the brain and regenerate the nerves? Our guest, Dr. Harald Burgard, will tell you today what there might be and what successes have already been achieved. You can look forward to it. Stay tuned. Hello, dear Harald. Nice to have you here.
Hello, dear Corinna.
Dementia Alzheimer's is a topic. Coincidentally, yesterday was Alzheimer's and Dementia Day. And then, of course, the topic was relatively present. There are also a few figures at the moment. You also brought a few figures with you. What is the current situation? What does the data look like in our society?
Yes, the situation is basically devastating, because we're simply seeing it, that there are more and more people who naturally get older at some point, of course, but also regardless of age. There are also more and more younger people suffering from dementia. We had almost 1.8 million such cases in Germany in 2021 and these people naturally become seriously ill. The most common form is Alzheimer's. There are also other dementias, which we'll come to in a moment. And we assume that around 440,000 people in Germany are newly diagnosed each year. And that's a huge number. And behind every single person, there is of course always a dramatic zigzag. These are often highly intelligent people who suddenly deteriorate and are worse off than a small child. As a result of demographic change, the number of people affected is naturally increasing. In other words, people are getting older. And because people are living longer, they are naturally more likely to be affected. And the previous therapies, what you could do when it has already occurred, unfortunately, they are very frustrating. There is nothing. We saw that again yesterday. Yesterday, the publications shot up throughout the day. We saw again and again that hardly anything helps if it's already there. But if you take appropriate precautions, you can try to slow down the process, or perhaps even prevent it altogether. So the question is, what can you do? And of course, you first have to look at what causes dementia in the first place. We can see that there are basically two main causes. One is neurodegenerative diseases. This means that the nerves are damaged, the brain is damaged, the brain breaks down, it shrinks, or the nerve cells break down. And then there are vascular causes, which means that the blood circulation is disturbed. And if there is not enough blood and oxygen and nutrients reaching the brain, then of course the brain dies. It's relatively easy to imagine. And what causes this? It is always caused by chronic inflammation, which has a variety of causes. And these chronic inflammations damage the nerves and kill them, or they damage the blood vessels and then the blood circulation becomes poor. And that is actually the essential thing. And what causes it then? Known are, of course, a lot of smoking, high alcohol consumption, high sugar consumption with diabetes. These are all things that we have long known can make you ill at some point. Not just Alzheimer's, but other things too. High blood pressure naturally destroys the blood vessels in the brain. Diabetes destroys the blood vessels in the brain. Diabetes also means that there is simply no more sugar, or not even enough sugar in the brain. And the brain consumes an immense amount. 30% of the energy requirement goes to the brain. You need 100 grams of sugar per day. But if the doors are closed up there and nothing arrives, then it will unfortunately go dark at some point. Obesity, with all its consequences, can also trigger dementia. And what we have also known for a long time is a vitamin B12 deficiency. Many people are not even aware of this. There was a study that showed that if I have a vitamin B12 deficiency, there is a large cerebrum shrinkage. I noticed this years ago on an MRI or CT scan that people with such diseases have a greater distance between their bones and brain. This means that the brain has shrunk. Then half a year later, there was a study that showed that if the vitamin B12 level is in the lower third of the norm, this is already starting to happen. And what has shrunk is gone. That's why it's important to check early on whether a person has a B12 deficiency and to compensate for it, because more people have it than you might think.
What role does the homocysteine level play?
The homocysteine value is an intermediate product that is formed when methionine is broken down into cysteine, usually due to B12 deficiency, or B6 deficiency, or folic acid deficiency, or B2 deficiency. But if homocysteine levels are high, it is always an alarm signal to check vitamin B12 levels, and not just for B12 in the blood, but also for the ability to metabolize. Today we are looking at methylmalonic acid. We are looking at holotranscobalamin in order to get a more precise statement. Does it arrive? Is the level sufficiently high?
What are the consequences if the level is too high? So why do you actually measure the homocysteine level?
Homocysteine levels are always measured to see if there is a deficiency, and homocysteine alone is an isolated marker that can cause vascular calcification and trigger a heart attack, stroke, dementia, etc. That's why it is one of many markers. That's why it's one of many markers that you look at, and it's often too high. People come in with values of 15, 20, should be under 10, better under 8, so that you can simply suppress or eliminate these negative homocysteines.
Have you ever heard of the correlation between B12 and tumor growth? I have now. You always hear a lot, but would you still be interested?
Yes, B12 is of course a substance that also stimulates cell growth and can therefore also stimulate tumor cell growth. I have not given isolated B12 to patients with tumors for years. I also don't give iron, which the tumor cells also use a lot of. These are things you have to pay attention to.
Okay, yes.
Yes, and another cause is social isolation, when people go out more. But if you have atrophy of the cerebrum due to B12, it often takes place in the frontal lobe. And that's the center of the brain that likes to bring you into contact with people. People then no longer like to go out. They no longer like to be around people. They withdraw, and the more you withdraw, or the more you simply lose touch with the world around you due to hearing loss or visual impairment, the more likely you are to develop Alzheimer's. A lack of exercise also means that the brain is less well supplied with blood, that the nerves no longer have to interact, and that can also lead to dementia. And then, of course, your genetic predisposition and epigenetics. Have the parents already experienced trauma? We are now seeing that these traumas are often passed on over 2 or 3 generations as a result of acts of war in Europe. And that can lead to problems that we don't even know about today. But we know this from epigenetics, inherited stress.
We also say repressed traumas that we no longer want to remember or process.
These are all building blocks that can lead to this. And then, of course, there is the huge, ever-growing area of environmental toxins. Why environmental toxins? Why are they so dangerous? We always hear that people are contaminated. We have toxins, we have mercury in fish, and I don't know what else. We have different effects from these environmental toxins. They're not just poisonous. They're not just toxic. That's the technical term for poisonous, but they also have an effect on your immune system. They have a hormone-disrupting effect. They can block the hormone effect that we need, or, in the other case, they can imitate it. And in tumor patients, if they have an estrogen or an estrogen-positive tumor, and I now have mercury or something in my blood that can imitate estrogen, then the tumor can go up as a result. They can trigger allergies. We are also seeing more and more allergy sufferers. That is also well known. You can always read about it. They can be mutagenic and carcinogenic. They can alter genetic material or trigger tumors. That's why environmental toxins are so dangerous. And then it doesn't always mean that you have to have a lot. But Haber's rule, which simply says that if I have a little poison and have it in my body long enough, it has the same effect as if I take in a large amount at once. Avogadro number is a number that tells us how many atomic molecules are in a mole. And if I know how much exposure I can find in a patient, I can't convert. How many molecules does it have? So 1 toxin per cell to be amazed that suddenly there are 12 molecules of mercury in your 80 trillion cells. And then you can imagine what it's doing there. But these things are often not even on the screen. And then rediffusion processes, if I detoxify someone and it leaks out of the cells again over time, then that also causes stress. It causes inflammation again. And these external carriers of inflammation, the viruses, bacteria that get into you or other things, medication and so on, can also lead to toxins being released. And normally some of this stuff is excreted. But what's left behind causes trouble in the long run.
There are also many people who say, I took out my amalgam filling years ago, there's nothing left. And these are the classics, you've probably heard them before.
But yes, if I take out the amalgam, then of course I have stopped the supply. Because whenever I eat something hard, hot, sweet, or sour, amalgam is dissolved. You can prove this at any time with a simple chewing gum test. I saw this in a patient just last week. She had a certain amount of mercury in her saliva, and then we had her chew it. And then afterwards, she had 2.5 times. We have 10 times. We have already found 2,000 times that amount in excretions. And people swallow this, and it goes into the body. And then the lead can be absorbed. And the holding times is what the body breaks down. For example, if I have mercury in my body and I don't excrete it, then it is broken down. But it takes 20 to 30 years to break down half of it. And with lead, it's even 50 years. In other words, the stuff ages with you and makes you permanently ill.
And you get the stuff. Well, I once had a provocation, such high lead levels, I didn't even know where it came from. So probably water pipes?
Yes, but it was also an anti-knock agent in gasoline for decades, and every combustion engine blew it into the air. And then you breathe it in or absorb it through your skin. And then you just have it in there if it doesn't hold out. And as I said, every second person, one of us, has the detoxification enzyme, not very toxic metals, and they just store the stuff and can't get it out. And then people become ill over time. And there are also these interactions where many things together suddenly have a much greater effect than a single substance, depending on the person, depending on their genetics. And then these environmental toxins cause damage. The blood vessels can then be damaged. Ages. That's a word that many people may not even be familiar with. If you overeat, if you eat too many sugary things, then advanced glycolysated end products are formed, i.e. saccharification molecules, which then prevent blood circulation, damage tissue, and so on. Or the uric acid goes up when free radicals are formed. Or foam cells develop, as I explained in the other article, as the first damage to the LDL cholesterols, which then clog the blood vessels.
What is it like if I really have a family history of, let's say, being preloaded, but I don't want to do toxopheresis right away, but rather perhaps work with chelate? For a normal person, let's say who is healthy so far, perhaps a little tired or lacking in energy, but not suffering from a chronic illness, how would you proceed? Would you use toxopheresis, or would you tell a reasonably healthy person to take 4 or 5 chelate or infusions?
If the patient is healthy and has no symptoms, or if he has symptoms.
First of all, no major symptoms.
If someone only comes for prevention, that's of course completely different from if someone comes and already has some kind of restrictions, who says I can't concentrate as well, or I'm not as fit as I used to be. I realize I don't have the words. I can't think of one thing or another. That's something completely different. So if I'm doing purely preventative therapy, we can do another show about that. I naturally take a different approach. But if someone is ill and has been damaged by environmental toxins, which do a variety of things, then I have to take a different approach. And environmental toxins always damage the gut-brain axis. And then you are often better served with toxopheresis because you can simply remove much more than with chelate therapy alone. It can only remove the toxic metals. Toxopheresis can, of course, remove all the environmental toxins and everything else that you can't get out with anything else. What is also often noticeable in Alzheimer's is that if you do a PET CT, where you look at what is coming up in the brain, you can see the sugar uptake very early on. This is often no longer correct 10 years earlier, not only for diabetics, but also for people who simply have ages or are beginning to develop insulin resistance. They simply don't get enough. It's a slow starvation of the brain, and it's always the result of Alzheimer's, of chronic inflammation, which then leads to insulin resistance, which then leads to starvation of the brain because not enough sugar arrives. And then, of course, you can look at what you can do. We'll get to that in a moment. And as we just said, we always have to look at what causes inflammation. There is a whole range of markers that we can measure and that we can reduce so that the inflammation that is in the body, which is transferred to the brain, prevents Alzheimer's from developing, or if such things are present, simply improves the situation. By removing environmental toxins through toxopheresis, not just toxic metals, but all sorts of things, by lowering antibodies and so on and so forth. You can do this by washing the blood. And above all, you can also seal the blood-brain barrier. Because if the doors are open and everything can get in there, then you simply have to close the doors so that the flood of toxic substances, pathogenic toxins, paints, varnishes, coatings, and so on is stopped. And the rheology, what it says here, improvement of blood circulation, that is something we can always measure. Fibrinogen decreases, blood circulation improves, and when more blood and more oxygen arrives up there and energy production increases, then the lights come on again, then light comes back into the darkness, as they say.
Do you have any experience with dementia patients who have come to you?
Yes, we always have patients with dementia. We've also had patients who were no longer able to communicate with you at all. I once had a lady who really just sat there. I could only take her with me. She went with me. But if she had sat down, she would have sat there for another 5 days. She no longer recognized anyone. Communication was not possible at all, and she was able to communicate relatively normally again after the therapies. She recognized her son and daughter again. She was able to take part in her old afternoons again. She was able to make phone calls again. Not as adequately as we can talk, but she was able to take part in social life again. And that was a very advanced case. Of course, it's much better if you start early, and the earlier you start, the better the results. Sometimes patients come in. We've even had young patients who were so advanced in their dementia that they didn't want to and couldn't be treated at all. And then there's nothing you can do. If they neglect themselves, if they let themselves go and do everything, then it's really already so far advanced that it's very, 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 very difficult. That's why the earlier you start, the more prevention can be achieved through therapy. And then it's just a matter of compensating for deficiencies. Detoxification is very, very important, but so are the surrounding factors. B12 levels, omega-3 fatty acids, which have an anti-inflammatory effect, including in the brain. The earlier you start, the better it is. We have already talked in an article about the fact that changes in Alzheimer's have already been found in children. If I look at the study, 51% of children from highly exposed areas had changes in their brains compared to 0% from the high areas in South America.
This whole topic of ADHD concentration should really be looked at. It's certainly very exciting. And we mustn't forget the things that are really inflicted on children in the first few years of life that pass through the brain barrier. These are also stresses and strains, including adhesive aids.
It starts right at the beginning.
And now the question is, would I be able to get that out through toxopheresis?
You can remove almost any environmental toxin using chelate therapy and toxopheresis. You can also search for them specifically. You can also carry out very specific analyses in the blood, before, after, or in the eluate. What comes out? You can do that. You can remove many environmental toxins. You don't have to detoxify someone completely. You only ever have to detoxify the body to the extent that you can cope with the rest, so that your individual tolerance threshold is undercut. Then nothing happens. And you can see this again by looking at the inflammation values, or the metabolic values, or energy levels. If everything doesn't normalize, then it's okay. And that can also be supported. You can give ketone bodies, or you can lead people into ketosis through their diet, because the brain can nourish itself with ketone bodies in the same way as with sugars, even much better. By also giving oils, MCT oil and so on, I can improve the brain metabolism. I can supply the brain with sugar via galactose, even if there is insulin resistance. I can use lithium to partially regenerate brain cells and neuronal connections. There are so many approaches that need to be considered individually and always combined so that people can be improved at an early stage. And I simply notice that they can then think clearly again, that the fog goes away, that they can find their words again, that they can articulate themselves again, that they have power again. And then the gut is also part of it. Insulin resistance is part of it. If we test early, HOMA index and things like that, which you can simply look at, where you can see very early on if something is happening, then they have high ages. That's years before they develop diabetes. What's going on there? Of course, you can then do ozone, then this hypoxytherapy, oxygenation, oxygen supply. And a cool thing is to put laser light into the blood, which can kill the pathogens, but also measurably improves energy production. In our practice, we also often work with transcranial low-level laser therapy. This means that we put it on in a helmet where we shine special light on the brain. And here, too, you notice that the therapy and the symptoms in the brain improve over time, simply because things that have been scientifically proven, studied, and published actually occur. There is more mitochondrial respiration, and therefore more energy in the brain. The release of NO increases and the blood vessels open up again. This results in cell-protecting processes and better oxygen availability. If the oxygen is there but cannot be released, it will not arrive. And then signaling pathways, connection pathways, and communication pathways are improved again. And all of this leads to the fact that Alzheimer's can improve again in the long term, or even not occur in the first place. As we have just said, the question was asked at the beginning, can anything be done to prevent it? We all know the saying, the wise man takes precautions. And that works here too, of course. If I can see what silent inflammation is there early on, then I can prevent it. I can always prevent rather than repair. I can improve kidney function. I can avoid side effects of medication. And many things that are not just specific to Alzheimer's, the earlier you start, the more damage you can avoid in the future.
For many family members, there is always a bit of fear and worry that it could be passed on. And then, of course, it's a valuable tool to say, okay, I'll just have a look.
So heredity, we know from genetics that 5% is inherited. About 95% are things that I can influence. Through my lifestyle, through diet, through the way I live, what I eat, how I smoke, and what we have just discussed. And the environmental toxins, these are things that affect us. We have no control over them. I can influence smoking and so on myself, but I can't influence what you breathe in and take in through food. But if it is there, and you measure it and go there early and reduce it, that's where I can start. That's where I have leverage. You also know that you hear unison when you talk about Alzheimer's. Once it gets to that stage, we have very few options to really improve it. That's why everyone goes there. You heard that again yesterday. Prevention, 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 exercise, social contact, and everything you ask for.
But things that work, I was in Würzburg over 10 years ago, coconut oil dementia. That was a big topic back then. There were studies on dementia patients who couldn't draw clocks. They were given coconut oil, and after 14 days they were able to draw clocks again. But who put that into practice afterwards? Who takes the time to give people 3 or 4 teaspoons of it a day? And these are also things that are added on top.
Of course, that's where the environment comes in. The partner, the children, other relatives or carers. But if you do that, or if the patient is still in a position to realize it themselves and say, okay, I'll do that now, I'll eat like this, I'll support it with MCT oil or whatever, the earlier you start, the less damage there is. And when the damage is there and you start using these things, you always see regenerative effects. How far they go depends on the individual case. But we've already seen some fantastic things.
Super. Thank you very much, Harald.
You're very welcome.
Then let's hope that we can regenerate again. Yes, I hope, or believe, or always think that we can regenerate.
The body is incredibly capable of regenerating. We used to say that the brain cannot regenerate. Today we call it plasticity. That's all it means. The brain is capable of doing this. We also see studies that show this. It doesn't happen as quickly as with the mucous membrane in the stomach, but it works. You just need patience.
Great. I wish you continued success. Thank you for being there.
You're very welcome.
Dear viewers, yes, for everyone who is, of course, personally affected, perhaps also through relatives, it is always a hope or an opportunity to get into regeneration or to take preventive action. And of course, I am always delighted when we have guests who accompany us on this journey. And of course, I would like to thank you for watching. Thank you very much. See you soon.